everyone. Welcome to this video on Holistic Dentistry. I'm Cindy. I'm here with Dr. Frank.
Big BK. Yeah, so that's why people call me Dr. Frank, basically.
Yeah,
because it's easier to pronounce than my family name.
And Dr. Frank is a dentist here at Al Dentaire Global. We're here in Montreal. Many people still ask about this field of holistic dentistry, and there's a lot of curiosity as to how is it different from the conventional dentistry. So, Frank, can you tell us what's the difference between what we're used to as a standard dental care versus holistic dentistry?
Yeah, sure. The main difference between a holistic dentistry and what you would call a classic dentistry is that we consider the patient as a whole, and we don't separate the mouth from the rest of the body. Which is what most dentists usually do. And if you do that from our point of view, you're going to miss a lot of very important information about the patient's health.
So basically, the teeth are related to different parts of the body, and you can tell if there's certain issues with the teeth, then you can help the person look at possible inflammation or infections.
Yes. It works both ways. Your teeth can tell us about overall health issues in your body, like inflammation in your body, problem with your immune system, lack of minerals, lack of vitamins, because we see when you have a gum disease or too many cavities compared to your hygiene, we know that the cause for that is not a local cause, but it's something else in your body. And also, when you have teeth or mouth problems, it can affect your body also. When you don't eat well, if you have too many bacteria, anaerobic bacteria in your mouth, it can affect your digestive system. It can affect your body in general because everything is linked together. Your teeth cannot be separated from your body. It's not like it's the mouth and whatever happens there does not affect the rest. And also your body can express things through what's going on in your mouth and tell us things about what's going on in your body in general.
So give us an example of how some area of your body can actually be less healthy, and that could be shown in your teeth. Like, give an example of that correlation.
Well, if you have your gut flora is not balanced, the mouth is the first part of your digestive system, and it all works together. So what is done in your mouth will have an effect on what's going on after in your stomach, in your gutter. In your guts. In your guts. And if the bacteria you have in your mouth don't do their job properly, then you won't digest well, you won't absorb well. And you may lack minerals, you may lack vitamins, just because the job was not done well in the first place, which is the mouth. The more and more information come as to how important what's going on in your digestive system is to your brains, to your the way you think, because it's a lot of neurotransmitters are built up there, and it's really going to affect your mood. It's going to affect your thoughts, and a lot of things are related. And the more research is done about it, the more impressive it is how each and every part of us is really important and linked to the others.
So tell us, what are certain procedures or equipment that you use in this dental clinic compared to a regular clinic?
Well, the most important part is that we pay attention to the toxicity of the materials that we use, and to how they act together, sometimes in a positive or negative way. For example, here in this clinic, we won't be using metal as much as possible, because metals create electric currents when they're together in your mouth, and we learned that at school, but many dentists forget about it and don't pay attention to it. So they're going to use, let's say, silver mercury fillings with metal-based crowns, with a metal frame for a partial, with titanium for the implants, and all these metals together are going to create batteries, are going to create oxidation of the metals, which are going to have effects on your body in general.
Can you elaborate a little bit more on the battery effect of the metal?
Yeah, the basic principle of a battery is that you place two metals with a different electric potential in a liquid which conducts electricity, and that creates a battery. So when you have two different metals, as I said, let's take a silver mercury filling and a metal crown made of silver, can be a precious alloy made of gold, for example. And when they are together in your mouth, the saliva conducts electricity. So it creates a battery between the two metals, and it's going to affect both of them. And it's going to have, you're going to have metallic ions transfer in your mouth, plus you're going to have that electric current that is created, and we can actually measure it in your mouth. It's very easy to do. Okay. And the potential of these batteries could be up to 3 volts, which is very big electric current compared to what the cells use to communicate between them. So it really can affect you.
Okay, and I know a lot of people do have a mixture of metals in their mouth today. What kind of effect could it have, this high current of electrical current?
Well, it can create more sensitivity, more acidity in your mouth, which is the local effects. But for some patients, I don't know if you've heard about these stories, where sometimes people would say, I hear voices, or I hear, it's like I hear the radio in my head. And it's actually, it can happen sometimes because it can create like an antenna in your mouth. And but mostly what the main problem is that metallic ions are going to travel through your body. It just doesn't stay in your mouth. So you can have mercury is not a good metal to have in your body. Some crowns are made of chromium, nickel, and you don't want these metals to travel through your body, because then they're going to be fixed in some cells and affect the way they work. Mm-hmm. And when you have these currents happening, it's happening all the time. It's 24/7. It's not like something happening sometimes and stopping. So it's really affecting your body all the time. And the main problem we have now is that people are exposed to a lot of toxics in the environment, in their food, at home, on the street, everywhere. There's a lot of toxicity around us.
Yeah, in the water supply.
In the water supply, everything, basically, what you breathe, what you eat. And as dentists, we want to help people get better. And if by not thinking about it, we make the things worse, we miss something major. Okay. So considering that, and we learn that at school again, and we are taught that don't mix the metals, it's really important. But when you start working in your own practice and you have patients and you have solutions to find, and sometimes you're in a rush, or you kind of forget things that don't immediately show effects. Mm-hmm. So you may place your filling there, and there's the crown and there's the implant, but it seems fine. Patient does not complain immediately, so you don't think about it and you keep doing it. Okay. But you have to think further than that, because most of the effects don't appear immediately. Mm-hmm. It takes sometimes a lot of years before you can see what's happened and why it's happened.
Yeah, and it accumulates. It accumulates with time,
over time. Definitely. Mm-hmm. And that's why also, once you realize what's going on, it's more difficult to take care of it, because it's been building up for years. Mm-hmm. And so working back is going to take a long time too. It's going to be more difficult, because your body copes with a lot of things. Your body is an amazing machine which can protect you, which can fight bacteria, can deal with a lot of things that it's confronted by, and it keeps you healthy, but there's a price to it. If you're in a healthy environment, you're going to live for a very, very long time, and you don't stress your body that much. Mm-hmm. But if you keep stressing your body all the time, then it deals with it. But it's like you're filling the bathtub, little by little, and then at some point it's completely full. So how are you going to drain it? It becomes very difficult once you realize, if you don't listen to the messages, for example, when, as I told you, we see there's inflammation in your mouth, mm-hmm. but you brush well, you floss well, and for us there's no local reason why there should be that inflammation. It's your body telling us that something's going on, mm-hmm. further, deeper, and listen to it and find out what's going on and change things. If you don't listen to the warning signs, it's going to be this. You see that in the mouth, or you're going to have skin issues, or you're going to be a bit dizzy, or you're going to have headaches, or you're going to have pain somewhere in your back or in your ankle or whatever. It's just your body telling you something is wrong. And it's not, well, I have pain in my ankle. Yes, but the problem may not be your ankle. Mm-hmm. Maybe because there's a problem in your liver, for example, which creates inflammation in your stomach, which is going to cause a tension in your back muscles, and and your body is going to compensate the position, shift your position to release the pressure here, so it puts more pressure there, and eventually the symptom you have tells us about something else in your body. But it's really important to listen to these warning signs.
Yeah, it sounds like there is some detective work to be done.
Exactly.
When you don't feel well.
Yeah.
Sometimes they don't actually appear on a scan or on a blood test. And is that why you work with a team of other specialists to help the patients?
Definitely, because we are dentists, so we specialize. Although we are open-minded and we're going to try and find different areas to explain what's going on. We are not experts in everything.
Right.
So we work with osteopath, naturopath, acupuncturists, to whom we refer our patients for them to help us find out what's going on. Where do we start and how do we work together? We do our part, but we need to know. For example, I have pain in my jaw. I have, when I open and close, it's clicking all the time. I can see that there's your bite is off. Some of your teeth are worn, some are not in the right position. So we can just consider, we're going to make some of your teeth higher, we're going to change the position, and it's going to fix things. But if there's another problem somewhere in your body, your body tells you by this clicking, well, something is off, but it's in the back. And if you just focus on the teeth and say, well, I'm going to change that, oh yes, it feels better. But the problem that is there is still there. And you just like shut down the symptom and you shut down the alarm. Yeah. It's like there's a fire in your house. So you just turn off the alarm and you say, okay, I don't hear anything, it's fine now. But it's not what it is. So we try things on our part, but we're going to ask the naturopath, can you see the patient and tell us how her liver is working? Does the patient detoxicate well? Does the patient have a acidity in their body? What can you tell us about what's going on there? How can we work together to really help the patient fix things? And the patient has to be involved in that too.
That's true. You have to be an active participant in your health.
Yes, yes.
Yeah.
Because we're not teaching, and it's like, when you go and see your doctor, usually they tell you, well, this is the diagnostic. You have this, this, this. You're going to take this medication, which is going to solve your problems, and that's it. You listen, you do what you're told, and that's it. But you're actually passive. You don't realize what's going on. There's no changes to be made. And when we work with our patients, it's different. We try to understand why we had problems, where they come from, the cause, and how to get to that cause, and how to change it, how to make things different so that it doesn't happen again. And it can be your diet, obviously. It can be your environment. You can live in an environment which is toxic because of the painting, because of the water, the tap water that you're drinking, a lot of things in your direct environment. It's multi-factor. So we need to get to the source, the explanation, and also your diet can make a big difference. Most of our patients eat very healthy food because they're kind of aware that there's more to your mouth than just brushing them, your teeth. And
because teeth are living, right? Are they living organs?
They are living organs. They have a blood stream in them. They have nerves. They have sensitivity. There's a blood flow bringing minerals inside them. They're definitely organs like your kidneys or any other organ in your body. And they're extremely sensitive. And they tell us a lot about what's going on in your mouth in general, but in the rest of your body too.